Hello, this is Dr. Huffman from Medical Travel Associates. This video is just a summary of what happened at this year's conference for the Medical Tourism Association, which was held in Washington, D.C. I am the Director of Medical Education for the Medical Tourism Association. I work with the University of Miami to create medical education credits for physicians. They're called CMEs, Continuing Medical Education. And if you're a physician, you'd like to learn more about that, contact us and we'll get you logged in so you can access some of our online CMEs. A lot of our education is not for physicians, but they're for destination surgeons, destination hospitals, facilitators, self-insured employers, and insurance companies. We want you all to understand what medical tourism is, or medical, surgical, healthcare travel. Some call it global healthcare. Essentially what you're doing is you're looking for the best value. Now that value may be across the street. You may need cardiovascular surgery. You live in a region across the street, it's a great hospital with a great price, and that's where you should be going. If, however, the surgery across the street is $60,000 and the surgery in another state is $40,000 and the same surgery of the same quality in another country is $20,000, we think you as a patient or as an employer who's paying for that, or an insurer paying for that, should have that option. So medical tourism doesn't mean outgoing international only. That is people going from the United States overseas. A lot of it's incoming. I live in Florida and we have a lot of incoming international medical tourism here in the state of Florida where people come into the state to receive health care. We also are growing a large segment of what's called domestic medical tourism. We have companies like Walmart and Lowe's and Home Depot and Pepsi and others that are developing relationships and contracts with providers, hospital systems within the United States to provide care. One example is Walmart has a relationship with the Cleveland Clinic. If you have a cardiovascular condition, you may opt to go to the Cleveland Clinic for your cardiovascular care. You don't have to. You can stay at home locally, but there are certain financial incentives for you to go to the Cleveland Clinic. It may cost you less copay or no copay. They may pay for your travel and the travel of a spouse or a significant other to travel with you. There's benefits to the self-insured employer in that there's a lower cost. So my particular interest in this field of medical tourism is providing pre-op, pre-travel, and post-op, post-travel care for that patient. That is called the continuum of care. Before you leave, making sure that you're getting to your destination healthy, there's no complications, that you get your surgery to the destination surgical center and have your surgery. When you come back, somebody's picking up on your care. Now that's the Achilles heel of this medical tourism or travel medicine. In many cases, you travel distance, come back, nobody's caring for you. And then we have complications. I'm from the bariatric world, and I spent 25 years in the bariatric surgical world where I took care of patients after surgery. We saw so many bariatric surgical patients travel to get a low-cost surgery because they were paying out of their pocket and they wanted to get the best value. But when they got home, nobody was doing any care for them. We had lap bands, which is an adjustable procedure. You need to push saline into this band to tighten down to lose weight. Many of our patients were going to Mexico or Costa Rica or India, getting a band, coming back, no adjustments. So they didn't lose weight. It made the lap band look bad. Well, it wasn't the failure of the lap band. It was a failure of the aftercare. And so I began traveling around the United States training doctors on how to care for these bariatric surgical patients, whether they're lap band or gastric sleeve or gastric bypass. Here's what you need to do, physician, primary care physician, to make sure the patient gets optimal weight loss. So now with the medical tourism industry, I've taken that to another level. I'm helping primary care physicians learn their role in pre-op, pre-travel, post-op, post-travel, orthopedics, cardiovascular, OBGYN, bariatrics, all sorts of surgery. So my job is to educate primary care physicians. So if you're a patient who's considering traveling, contact me so I can contact your physician and help your physician understand his or her role. If you want, you can download my latest CME approved presentation that is on the website here from the conference that was held in Washington, D.C. just a few weeks ago. And one of the CME programs is pre-travel, pre-operative patient care. The other is post-operative, post-travel patient care. And it talks about the continuum of care that need to meet the patient's needs prior to surgery and after surgery to get our best outcomes and reduce our risk. Because we know that if nobody is picking up your care when you get home, you have increased risk of complications. And those complications get very expensive. And that's why self-insured employers, a lot of insurance companies are reluctant to participate in this medical tourism or medical travel because they see complications from people going out and having surgery and coming back. And next thing you know, the patient's in the emergency room with a serious complication that's costing somebody a lot of money. So we engage primary care physicians to begin the screening process immediately upon return of your travel destination. Whether that travel is into another state in the U.S. or around the world, we want that primary care physician engaged. And so that's what I do as a physician educator, is to educate the physicians, educate the self-insured employers, and educate patients and insurers. So if you're a patient, you're considering traveling. If you're a destination surgeon, and destination means you could be anywhere in the United States or anywhere in the world. If you're a destination hospital, if you're a self-insured employer paying for this, or an insurance company, contact me. I'd like to help you develop your medical tourism delivery system. We know that medical tourism or medical travel can significantly reduce healthcare costs. We want to ensure that this reduction of costs comes with improved outcomes, better outcomes, lower risk. And so if you can, please surf our net, our website here, get all the information you can, contact us. We have a contact page where you can contact us on a cell phone. So just give us a call, contact us. We'd be glad to chat with you. It doesn't cost anything to talk. So give us a call. We'd be glad to walk you through this process of medical tourism. And please download my most recent University of Miami CME approved medical tourism programs that's on the website here. Thank you very much.